I'm Sarah Clark with Cox Communications. Welcome to Community Connection. This show highlights local organizations and leaders that contribute to our healthy, vibrant community. So stay tuned. We'll be right back with our guests. Watch for Backbeat in Santa Barbara, San Diego, and Orange County. Find out more and like us on Facebook. Search SB Backbeat. Hi, welcome to Community Connection. I'm your host, Sarah Clark, and today with me I have Deborah Holmes, the Associate Executive Director of CALM, and Lori Lander-Goodman, the Director of Development. Welcome to the show. Thanks for being here today.
Thank you for having us.
Thank you.
So I'd love to start with talking about CALM and how it was started and what the organization is about for those viewers that aren't familiar with it.
Well, CALM has an amazing birth story. It started in response to the death of a child back in 1969. The baby had been shaken to death by his 19-year-old father. And the wife of the attending physician, Claire Miles, was so upset by what had happened, she decided this should never happen again in our community. So she called all her friends, and she took out a second phone line in her home, and she asked them to sit around the phone 24/7. And then she took out a small ad in the paper that said, "Stressed parents, call this number." In the first month, they had 35 phone calls.
Wow.
So she knew that this was a problem that needed to be addressed, that parents need support, and they need a place to turn. And that's how CALM started, and we've stayed true to our mission of preventing child abuse and healing children from child abuse for the last 43 years.
Wow. And tell me a little bit more about the mission of the organization now and how it's evolved.
Well, as Lori mentioned, we have stayed true to that original mission to prevent, assess, and treat child abuse. But now, after the very humble beginnings, but important beginnings of a hotline, we have a comprehensive array of programs for children, prenatal through 18 and even up to 21 for youth who've been in foster care. And we have multiple programs that are all what we consider evidence-based, in other words, shown to be effective in terms of preventing, assessing, and treating child abuse.
Wow. So, and talk a little bit about some of the issues and problems that you see children in our community facing today and how you can help with those.
Well, you know, a lot of the children in our community live in poverty. 1 in 5, in fact, live in poverty. That can be a tremendous stressor for parents and have a major impact on children. Also, we know that substance abuse is quite prevalent, and this also can impact children's lives, especially, you know, sometimes even being exposed in utero to drugs and alcohol. That child is going to be born with some risk factors, maybe having to detox from a drug right when the child is born, and then have possibly learning difficulties, social emotional difficulties, and so on. But in general, I know we live in a beautiful community, and it's hard to believe, but there are many children struggling with risk factors.
So how does CALM find these children, or how do these children find CALM to get the help and resources that you offer?
Well, one of the ways we get referrals from many community partners. We get them from doctors, nurses, cottage hospital, preschools, K through 12 schools. We get them from the family resource centers around town, and also quite a few self-referrals, people who hear about CALM, who get help from CALM, and then refer their friends or their family members. So we get them from very many different places, also from the county departments, alcohol, drug and mental health, and child welfare services.
Wonderful. You're fully integrated into the community and have a lot of collaborations.
Oh my gosh, we are very well connected in that respect. And I would say that is one of Calm's strengths, is we have very innovative collaborations with many, many other agencies. And also, most recently, a very robust collaboration with some preschools, where there are children with challenging behaviors or with risk factors. And Calm is able to go in and work with the teachers to support them as well as the parents and the children in those settings.
Wow. So how many families in our community do you serve?
Well, last year we served 2,500 individuals.
Oh my goodness.
And in addition to that, we did workshops with children in Safety Town, in the public schools, and we believe that reached around 7,000 children, teachers, and parents. So that's not therapeutic, that's educational, but we are doing that in Santa Maria as well as in Santa Barbara and Goleta, Carpinteria.
And going back to the theme of collaboration, some of our staff work in family resource centers from Carpinteria all the way up to Santa Maria. And there we are able to interface with more families. They don't necessarily come to Calm, but we're out there in the community working with them and bringing our expertise in mental health services and child abuse prevention to those communities.
So talk about some of the programs that you offer for these children and families.
Well, we, as I mentioned, we like to focus on evidence-based practices. So some examples of that would be something called trauma-focused cognitive behavioral therapy. And this is very effective with children who've been abused. It is a program that, first of all, accounts for the trauma a child may have been through and helps them to identify the feelings they may be having, and then work through understanding it's not their fault and developing another narrative, if you like, another story about what happened, because very often children blame themselves when they're abused. So this is a very structured type of a therapy with a lot of focus on the child, their feelings, who's responsible for the abuse, and how they can heal and feel more confident and gain back self-esteem through this particular therapy.
And it's probably so important to do that at a young age so they can establish a new narrative or story before it gets too late and that's already ingrained.
That is so true. That is so true, because oftentimes if the child does not get help, they grow up with that feeling of lack of confidence, low self-esteem, and what happens is they often are attracted to situations and people where the abuse will maybe reoccur in some fashion. They're more likely to engage in drug and alcohol use, become sexually promiscuous at an early age, and the trajectory tends to be going along that path rather than the happier, healthier, more secure, confident growing child who can then make different choices for themselves.
Right. So how can child abuse be prevented? Is there, is there a secret? What can we do?
Well, it can be prevented at any age, but we really believe there's a value to starting as early as possible with prevention. So that's why we try and start prenatally in one of our programs whenever possible, because the child, even unborn in utero, is experiencing the impacts of a parent using drugs and alcohol, a couple engaged in domestic violence. The growing baby's brain is developing even before it's born, and they may experience insults even in the womb. Parents are very open at that point in their lives. They don't yet perhaps have the child, but they want to be good parents. They want to provide for that child and give them a happy, healthy environment. So starting prenatally with education, with support, with looking at how can you have a peaceful home? What kind of things do you want to bring to this child in the way of protective factors so that they can have a good beginning? So that's where we start with the prevention program right there.
Some of the things, other protective factors, are just a strong parent-child bond. And I know we think it's natural, you have a baby, you fall in love immediately, but that's not always the case. So some of our therapists just to help parents have reasonable expectations about what a baby does, that crying is normal, that the baby isn't out to get them. And having appropriate expectations, learning how to look a baby in the eye, to talk to him or her, enables a deeper bonding between parent and child. And that, in fact, is a big preventive factor, not only within the family, but external to the family, because the stronger the parent-child bond, the more likely the child is to feel safe at home and speak out about anything that is uncomfortable.
I'm so glad you mentioned that, Laurie, because we have another program called Parent-Child Interaction Therapy. It's for children aged about 2 to 8, and it really focuses on attachment, and it teaches the parent how to follow a child's lead, how to play with a child. It might sound unusual, but sometimes parents really don't know how to play with their children. They don't know how to read their cues. They're not really tuned into them emotionally. And this program really focuses on building that bond, building that relationship. The children love it because they get tons of attention. And the parent feels very empowered because they're right there in the room working with the child. The therapist is behind a mirror coaching with a bug in the ear. And so the parent really gets to speak the words, have the interaction, and also feel rewarded through the relationship building.
Wonderful. Well, how can our viewers today help? How can people get involved?
Well, now is a great time to help. We have an Adopt a Family program. 243 of our families have requested help this season. And what we do is we ask the families to work with their therapist to create a wish list. And then we match a family who in need with a family or a business, and they shop and provide things on the wish list. And examples might be pajamas or diapers or a Target or grocery gift card. So that's a great opportunity.
Wonderful. Well, thank you so much for coming on the show today and sharing more with us about CALM and all the wonderful things that you do in our community. We all really appreciate what you're doing for our children and families, so thank you.
Thank you.
And thank you for watching Community Connection. We'll see you next time here on Cox 8.